Tēnā koutou katoa. I would like to open today's session with a karakia, a blessing. And the karakia I'm going to use today is one created by a couple of friends of mine about the ocean just down the road from my house. And when I was thinking about the body of water that joins Australia and Aotearoa together, I thought this karakia would be appropriate. So I'm going to open Inoi Tātou. Tau rewa rewa ko te karenui, tau rewa rewa ko te kariroa, tau rewa rewa ka whati te tuatia, te puapua o te tuatia, ka tere ki te tai karukaru e, kai ki panuku, kai ki takoroa, haumi e, hui e, tai ki e. He mihi nui, he mihi mahana ki a koutou. I would firstly like to acknowledge the atua for bringing us here today. Ngā mihi. Secondly, to our ancestors as a collective from both Australia and Aotearoa, and ngā mihi, and a special mention too to the passing of Leanne Takaru's father earlier this week, ngā mihi. Thirdly, to those presently listening to this webinar, and to the kaupapa that paves the future potential for potential change, considering what we know and what we want to know about cultural safety, ngā mihi. Ko aia, who am I? Ko taki teme te waka, ko aura ki te mauka, ko waimakariri te awa, ko aro whenua te hapu, ko aro whenua te marae, ko kaitahu te iwi, ko ena tiatia whātuisi Latu tako ingoa. In short, my last name is it's very long, but the rest about me is that I hail from the South Island of Aotearoa, New Zealand. My name is Anna. My last name is Tiatia Whātuisi Latu, married to a beautiful Samoan man. I've been working in the University of Otago for about 12 years as a Hawara Māori lecturer, and most recently moved into a senior lecturer's position at the School of Pharmacy. So I've been invited along today to MC, or to be part of a conversation with two beautiful wahine, two beautiful women, and I'd just like to mihi to them shortly, but also to welcome everybody to this webinar. Welcome to the Australian Pharmacy Council's webinar, conversation number 2. What do we know? What do we want to know about cultural safety? Today's conversation is an extension of the literature review entitled Cultural Safety in Pharmacy Education, written by Dr. Erica Sainsbury, with a real opportunity to talk to some of the highlights of completing the literature and the impact it has had, especially within Erica's life journey. And when speaking to Erica earlier, she said, let's just have a conversation. So that is exactly what today is going to be. And alongside us, we'll also have the beautiful Associate Professor Faye McMillan, who shared many highlights from her amazing journey in conversation 1 of this series. So before I start our session today and we start talking, I wanted to inform you that Erica has also uploaded a pre-recorded presentation of the results from her literature review. Feel free to watch these if you haven't already. And hopefully that will allow us to have a more intimate conversation about our aha moments. Also, to let you know that we will allow about 10 to 15 minutes at the end of the talk for listeners to make comments during the talk. We will respond to any questions that you may have whilst listening. So please feel free to post your questions in the chat function as we go. So that's enough talking from me. Let's begin. I would like to start with an icebreaker, and I wondered if I could ask the beautiful Erica and Faye to imagine you have written a biography, and the title of your biography will be your favourite song. So first and foremost, I'd like to hear from you both about your favourite song. I too will share mine. And then the second chapter will be entitled, What Culture or Cultures Do I Identify With? And if you could share a little bit about yourselves in that space before we move on to the third chapter, the second chapter that will ask what your values are, what value matters the most to you. And our last and third chapter is, what is the first thing that comes to mind when you think about cultural safety? Clearly, that's what we're here to talk about today. So we've popped these questions in the chat too for any of those watching the webinar today that wish to reflect and share your own responses to these questions. Feel free to do that. It'd be awesome to know who's watching today. But can I first ask Erica, would you mind sharing your favourite song for us? And then Faye, if you don't mind following, please.
Kia ora. Anna and Yama Faye, and thank you very much and welcome everyone. Yes, I would be happy to share that. My favourite song is actually American Pie by Don McLean, and it's interesting that it's this week it turned 50. So it's been around for a long time, and I do like music, but I guess that's music more from the earlier parts of my life. And I think, you know, the music that you hear in your formative years can be very influential. I love American Pie because I don't really understand it very much. And Don McLean has gone on record saying he's not going to tell anyone. So to me, it's a lot like life's journey. There are some bits you understand and some bits you do. But you take it as it is, you go along for the ride and you enjoy it. And if you do finally understand some parts, then that's a blessing. So
Sure.
yeah, that's the chapter of that's the title of my book, American Pie.
Kia ora, Erica. Faye, can you tell us yours, please?
Kia ora and Nora. Mine is The Gambler by Kenny Rogers. And probably the reason it's for me is the emotions that it evokes. That it was a song that we all could sing along to, and so it evokes memories of family being together and singing a song. And when I became a mother, it was a song I knew from start to finish, and so it was what I sang to my children as their lullaby. So it's, and there are elements to the song that sit nicely with life that I think, you know, that there are pearls of wisdom in there. And you know, as I get older and listen to the song more for the words, that it relates to lots of aspects. But I think, you know, that's The Gambler by Kenny Rogers is for me.
Kia ora. I think that's great. It used to be the song they'd play at the clubs in New Zealand when it was time to close at the end of the night. So I know the words too very well. But my favourite song and the title of my biography is similar. It's a lullaby. It's called Lima La Iti. And it's a Samoan lullaby that I have sung on repeat with young children every night, trying to get them to sleep. It's almost become a very irritating song at times, having to sing it over and over again. But I guess it embodies my story, because really it is about my children and that lullaby and how much it means to me. So when I think about culture and all those sorts of things, I often think about the future, what it holds for my family. Can I ask you to now share both for me your chapter 1 of your biographies?
Shall I go first, or Faye, would you like to?
Go for it. Yeah, okay.
Yes, thanks, Anna. Look, I think first and foremost, I identify with the human race. I know that sounds a bit trite, but one of the things that certainly was foundational in this literature review was understanding that we are, I hesitate to say all in this together, but that there are universal truths, and as individuals, you know, there should be nothing that makes one of us better than the other. And so I think that's really important to understand that, the first and foremost, we all belong to the same human race, and that's really important. I do identify as an Australian-born person. I'm not Indigenous, but I do identify as an Australian, and I love being someone who was born here and lives here and can follow Australian sporting teams and cheer loudly and enjoy their success. But I love Australia. I think it's by and large, it's a wonderful place to be, and I wouldn't want to live anywhere else. And so I identify with that. I'm also a person of faith, and I certainly I identify as a person of faith. I'm a Christian, and that is also a really important part of my identity.
Awesome. Kia ora, Erica.
For me, I identify as a Wiradjuri, you know, but I acknowledge that there are other components that make up who I am, but because I didn't grow up knowing them intimately and appreciating them in the same way that I appreciate, you know, and acknowledge being Wiradjuri, that they sit there not fully being understood by myself. in that space. So I have English father who I don't have a relationship with, so I don't have that connection to his culture and the understanding of his worldviews or those influences. So all of my influences have come from being Wiradjuri and being in a family that acknowledges that that is who we are, but that there are significantly other components. And, you know, I do think we do need to acknowledge that we are multifaceted. Every one of us comes with opportunities to, you know, acknowledge all of the bits that make us who we are. But I think the struggle sometimes is when you don't know that. So, as I said, for me, it's Wiradjuri and it's the only world that I've ever known. And it's a different world to every other Wiradjuri citizen too, that, you know, my own experiences are my own. And those opportunities to have similarities have informed my identity, but they're not the same as every other Wiradjuri person either.
Kia ora. I like this question. In the years that I've been teaching, we've been encouraging our students to ask around ethnicity. Which ethnic groups do you identify with? And I've had some real interesting moments where students have said to me, what do you want to know for? Isn't that a racist question? Why are you asking that? And of course, we know if we don't collect the data, if we don't ask the question, we're going to be missing what's really happening in health for our patients. And so there's a key question that we encourage our students to ask is around ethnicity. But when we're talking culture and we start talking that more, we start to think, oh, actually, I'm not just talking about ethnicity. I'm talking about the culture of me being a woman or the culture of me being a mum. Actually, in my day job, I'm an academic, and we have a serious culture going on in academia that looks quite different to many others. I've been raised playing sports. I know that we don't always win against your nation, but we are fighters on the field, and I'm proud of that fact too. So a real sporting culture in amongst my whānau. But to get back to why we ask about ethnic identity and to think about what difference that makes in health, I think we have to address that more quite quickly in our consultation, in our process of engaging with patients. And so I think it's nice to have that as our first chapter in our biographies today, to consider what ethnicity means. Have you got any more thoughts on that before we move on to our next chapter?
I do. I just think, as you say, sorry, Erica, as you say, Anna, it's a really important thing. It often grounds people to a sense of belonging and creating opportunities. And when we ask the questions, when people have had the opportunity to understand who they are, then it means that what we can share together can be more meaningful and not surface. And that's a real integral part of relationships in health and trying to achieve good health outcomes for everyone.
And I would add that I think when we're building up our identity overall, that as Faye said, there's so many parts to it, and they're not disintegrated. They go together to make up who we are, and you can't just take us apart and put us in different places and take bits of us and take us into different contexts. But I do think that we also need to recognise, and this is important for me, that in different situations, the parts of me that are like obvious and enacted and the part of my identity that is perhaps at the forefront is different depending on the context, and particularly depending on the people that I'm with. So I can be a daughter or an aunt or a sister in particular contexts. In other contexts, I'm a teacher. In other contexts, I'm a learner. Hopefully I'm a learner in a lot of contexts. I'm a pharmacist in some contexts. So I think it's really important that we're really conscious of who we are, and that also to recognise that we take everything with us, but we don't necessarily show that side of us in every relationship and every conversation that we have.
Yeah, I love that. It also reminds me of sort of identifiers and thinking also about names. Here in Aotearoa, we often, pick a name and think, is that a Māori name? Is that a Samoan name? And, you know, with my beautiful last name, Tiatia Whatuisi Latu, I've had people saying, are you Tongan? Because Latu is a common last name in the Tongan culture. It isn't. We are Samoan, but it's the first name of my husband's grandfather. And so it has huge meaning. And I remember when I was having my third child, walking in to get an ultrasound, sitting there waiting, and a lady came out and she actually looked at my name and went, oh, crap, and struggled in that moment. And I was like sitting there thinking, did she just do that? Did she really just say that about my name? My husband was doing the calm down, Anna, just breathe. We're going to be all right. We'll get through this. And I said to her, you know, my name has meaning. It's an identifier. It's part of me. It's part of who I am. And I'd really appreciate it if you didn't know how to pronounce it, that you asked me. And she said, righto, how do I say it? And I answered, and then she said, right, get in there then, come on, let's do this. And so that's another great example for me to share with my students. When you don't know someone's name, what do you do? How do you ask? And I think lots of the things we're going to talk to today are going to be around, if you don't know, what do you do? How do you ask, and how do you do that in the right way? So identifying ourselves, who we are, where we belong, or feel we don't belong. I've also had students say to me, you know, Anna, I have Māori whakapapa, but I don't identify as Māori. I haven't been raised Māori. And therefore, that's really important to know too. Every time they come into the pharmacy, I'm not going to be saying, have you changed your mind? Are you Māori today? That's not something I'm going to be doing, but probably noting that this person identifies that they have whakapapa, therefore I need to know this for their health outcomes. But I'm not going to be badgering them to change their minds. So lots to do in introducing ourselves today as clear examples of best practice too. Let's move on to our next chapter, if you don't mind, Erica.
Can I have more than one value?
Yes, you may.
Thank you. Sorry, please, may I have more than one value? Look, for me, the two that are equal for me are integrity and humility. I'm not saying that I've got them and that I've reached that point, but those are things that I would like to be known for. And it's a bit weird saying you want to be known for humility, because that's kind of counterintuitive, but I would, those are the areas that really matter to me. And integrity covers a whole range of things: honesty, transparency, accountability, and that whole range of things. And humility, I guess, to always be a learner, not to assume that I know things. And for me, that's quite hard, because I have spent a lot of my lifetime assuming I've known things, and then having to be rebuked, if you like, when I actually encounter situations where I thought I knew something and I didn't. And that's certainly been a part of the process and the journey associated with what we have now in the terms of the literature review. So those I guess those two are the ones that are most important to me.
Kia ora.
Like Erica, I'm going to acknowledge that there is more than one value that I believe underpins all of the work that I do. But, you know, family is a value, or the sense of family and how you treat family, which goes, I suppose, to the next part, which is empathy and kindness. You know, that they're values that I hold as really strong parts of being myself, and that I would like to potentially see more in some others as well. Reciprocity, you know, the value that there will be moments of give and take, and moments of, you know, sharing that are there. And there are a lot of them have bigger, you know, but they start with that one ripple, and that ripple goes out and impacts on so many others. But I think they're the values that do carry me through, which is integrity, as Erica said, the honesty in which I undertake things. And I can only do that through that lens of the values that I hold. And they're really important to everything I do.
Kia ora. This conversation again evokes a lot for me, thinking about what your perception of a value is compared to my perception of a value. And we might be saying the same word, but have completely different meanings behind them, right? So, Erica, when you started with integrity, I went straight to trust, but my ideal of trust, or that value of trust, could look quite different to what you expect trust to look like. And so again, it comes back to everyone has different values. Some are similar, some are entwined perhaps, but actually until we get to know people genuinely and ask people what their values are, what matters to them. And one of the experiences I had personally many moons ago with a fantastic nurse, she asked me, what could I do to get it right for you today, Anna? What could I do for you? In that moment, I was so shocked because nobody had ever asked me before. I was sort of stumped. I went, oh, I don't know, treat me like everyone else. And then I later went, no, actually, there's some things you can do differently for me. Thanks for asking. So I love having this opportunity to talk about values. And not forgetting that when we're talking cultural safety, that actually a lot of this is around asking people what matters to them and not making assumptions that we already know. So thank you for both sharing what's valuable to you. I think I'm very similar, although I'm probably not as kind as you, Faye, but trust is a big value for me. And I've decided to have lots of really diverse children, and they bring all of those other nice things that I don't have and teach me good things along the way. So thank you for sharing that chapter for us. Can we move on now to our third and final chapter? What is the first thing that comes to the top of your mind when I ask you about cultural safety?
It's probably a little odd to ask me because I've spent a lot of time thinking about that. And so the first thing that comes to my mind really is that we can't make assumptions about what a culturally safe space looks like for someone else. And if we do that, then that's probably not going to result in a space where other people are feeling safe. And that's what's important is if particularly in the context of healthcare, if we're the healthcare provider, safety, what we think safety looks like doesn't in the end doesn't matter as much. What matters is that we allow other people to feel safe in that space. Yeah, that's the first thing that comes to mind. There's a lot more, but that's the first thing.
Cheers.
For me, when you ask this question, Anna, I've come at it from two worlds, and I think for a lot of First Nations people, it is trying to blend two worlds together. I come at it first from a Wiradjuri space, which is cultural safety, very individual, very about, what are the things I need to feel like I can be authentic and that I'm not going to be judged. And so that's, from that Wiradjuri lens. But when I look at it from a professional lens, the first thing that comes to mind is we just have to get better at it, from a professional point of view, that we just have to, we've got to step up. We've got to start, as you said, looking at people that are trying to explore ways of how does cultural safety look for every person, and not assume a homogeneity goes with cultural safety. And so, that moment for you with that nurse about, being asked, what can I do for you? It's not very often, and it's still not very often that, health professionals are asking those questions or that specific question. And they're the bits that make me go, we've got to do better.
So there's that sort of thought around, we've come some way, but we've got a long way to go yet. And I guess looking at Erica's literature review, there is a fair bit being done, talking about cultural safety competence, whatever language we want to use. We've got models, we've got so many different things now that we've had evidenced. But what do we want to see the future look like? What have we got to do now to make a difference for the future? Thoughts on that, Erica?
Yeah. Well, it's a very broad question. am I able to narrow it down to
Yeah.
health professional education?
Yeah.
Is that, because I think that's really what the aim of the literature review was. And it's also, I guess, to underpin APC's contribution to helping education providers to create more culturally safe. Look, I don't like the terminology culturally safe practitioners, because I don't think that's right, but the practitioners who are conscious of and are work towards culturally safe, creation of culturally safe spaces for their work. I think there were some key things that really emerged for me from the literature review, and things that I think I would like to share them from my own personal point of view, because I think that it is something that needs to be experienced by individuals. I think it's not a case of let's just look at this objectively like a curriculum transformation or a curriculum change. And for me, the first thing that really emerged from this was that I came out of the process as a different person. And so as an educator, as a pharmacist, as a person, we need to look at our personal understandings first before we can start changing our educational practices and our professional practice. And so, yeah, that for me is the absolute critical thing, is to say, step back, understand where you're at now, understand your own assumptions, your own biases, your own worldview, your own values, beliefs, attitudes, and your own understanding. But don't stay there. And you can't change your practice until you're aware of your own situation and aware of a need to change. And that became really obvious to me. As a educator, a long-term educator, over 30 years of teaching pharmacy students at Sydney University, and thinking that I was doing the right thing by including Aboriginal Indigenous content into the curriculum. But I was doing it in my own way. I wasn't doing it in a way that really did justice to Indigenous ways of knowing and understanding and being and doing. I didn't talk to anyone really who had insight into that, because they were actually Indigenous. I met Faye, was about 5 years ago, and but I expected Faye to fit into my conception of how to teach. I didn't ask. And for me, doing this literature review really made it clear to me that my whole approach wasn't the right one. It didn't do justice to Indigenous perspectives. And in particular, I think there was a light bulb moment. Well, it wasn't a moment, it actually was a light bulb, probably a few months and years, where I actually understood, or weeks and months, maybe not years, where I understood that for me, what I needed to change was how I thought about Indigenous health, for a start. So in the literature review, we'll see I talk about the deficit discourse. I talk about the fact that all I'd been brought up to understand was that there were problems, that there were statistics that said Indigenous people had shorter lifespan and higher levels of morbidity, higher levels of hospitalisation, poorer access to health services. So for me, I was brought up along the lines of a discourse that said Indigenous people have these problems and it's up to us to fix them. Whereas what became really clear was when I was listening or reading, but listening to the voices of Indigenous people, that's only part of the story. The part of the story that I wasn't hearing was, the oldest living cultures in the world. Indigenous cultures have been here for 60,000 years plus, and they've lasted for a very long time. And so they must actually know something about health and well-being and wellness and survival and thriving. Why aren't we listening? Why aren't we asking the questions about, well, why is it so different now? What is it that is different about this? And so that was a bit of a light bulb for me to say, hang on, I don't have the answers. I haven't asked the right questions, and I certainly haven't listened to the wisdom and the deep knowledge and the deep understanding and the just whole different way of approaching health and wellness that is in those Indigenous cultures, and we need to step back and learn. So yeah, that to me is the issue. It's a transformation of approach, understanding, and if we first do that, then I think the rest of it can flow.
I like how you say we need to learn. I think when you say step back and learn, I think we need to step up and learn together. That was one of the key things that I heard from your kōrero then, is around, how do I create relationships to join in with the likes of Faye and others to find out what it really means. Any thoughts on that, Faye, and the thought of relationships to make a difference?
And I think, and for me, the word relationships as opposed to partnerships are where I really see the transformation happening. A relationship insinuates that there is opportunities for growth. There are opportunities to make mistakes, and for Ubuntu, other cultural practices of knowing that, there is still good even when at times we've made mistakes. It doesn't mean we need to undo everything that we have done together to, go back and, I'm just there, I'm listening to you and Erica, and, there is a step back, step up process to this, that we need people to reflect on who they are and why. And it goes a bit back to the conversation earlier about bringing all of yourself to the conversation, not just this, I'm a pharmacist, in this context space, to what are the things that I know that inform all of me, that when I'm in here and practicing my craft of pharmacy, that I actually need to consider. And Erica, and we use stories so much to try and bring about, but I think about when my grandmother knew we had people coming to visit, that the good things had come out, the bits that you would put on display, that, you wanted people to know that you either had, or, that these were significant parts, but then they'd get put away when people left to, we don't want to reserve those things just for a moment. We need to bring out the good things all the time. And so that's to understand. And I think that was Erica's step back moment, and try and see, well, what are all the other bits that I can bring to my stepping up as a pharmacist in this context, or in health, to create those different narratives around what can we do together? How can we use our relationships to create a future that allows everybody? And I can, reflecting back on when Erica did, ask me to come to Sydney Uni to give that talk, as she's pointed out, I put in some statistics, and I vividly recall actually in the lecture saying, we are more than statistics. For every time we tell you that, this affects 10% of the population, that's somebody's father, that's somebody's grandfather, that's somebody's mother, trying to change the fact that there's a human being, there's a person that has connections, that has relationships, that is going to be, sorely missed, and all of those other emotions that are involved. And we're not statistics. And, so to hear Erica talk about to change that discourse, anybody can learn statistics, anybody can look up a number. But when you've lost somebody to a particular illness, or for a reason that you go, we can do something in this space together. So they're the moments that you look for, and they're the bits that, I'm really excited that APC have agreed to start, be on this journey with the Indigenous Strategy Group, with Aboriginal and Torres Strait Islander pharmacists who choose to be pharmacists but want to bring all of themselves to their role. to, you know, Māori relationships that have occurred where, you know, through the work of Leanne and so many other Māori pharmacists and health professionals, that we've started to see this real change, and they're the bits that we need to have. They're the hard conversations, but necessary conversations.
Mm. I had a lecture a long time ago now where a student yelled out to me in the moment saying, you know, I wasn't there, you're teaching me all this stuff, it wasn't my problem. And luckily Anzac Day was following, and I was able to say, you know, I wasn't there, not my problem. And they said, no, you can't do that, Anna, we need to remember. And I said, exactly, let's look at that line of least we forget, but make sure it doesn't happen again in our future. Another lecture I've had where another student shouted out, was saying, you know, you're teaching us this model of cultural safety, looking at awareness and checking ourselves first, moving into knowledge and really knowing things, and then actioning. And he said, there's more. And he got really excited. I said, what is it? I said, we need to become activists. We need to advocate wherever we go. As soon as we have our aha moments, we need to become champions for change and get excited about that. And I said, wow, I'm excited to see the next future of thinking like this already. But then I also have colleagues beside me who say, you know, it's all good and well telling us that we should be making a difference for Māori, but there aren't many Māori to go and even ask for relationships with. Where do I start that journey? How do I have a relationship with someone like Faye if I don't know Faye? So sometimes I don't know if we want to use an excuse, but the comment that I hear is people saying it's not as easy to just go out and create relationships with Indigenous as you make it sound. I wondered your thoughts on that, the peer review.
If I can go first there, sorry.
No, you go first, Faye, because I actually want to backtrack a little bit to one of your previous comments in that section, Anna. So Faye, please go first.
I think it's like, you know, there's this assumption that being in a relationship or being in relationships with Aboriginal Torres Strait Islander Māori, you know, Pacifica, is any different to being in any other relationship. It's like, it has to start somewhere. It has to, you know, have a connection. And sometimes it's just hello, you know, sometimes it's just, you know, I've reached out to people that I don't know through mediums that, or I've been brave in moments. And as you said, rather than, you know, oh, I'll hide behind, I don't know them, I don't want to intrude, and to go, oh, look, I know of you, you know, I admire this for this reason, I'd like to have a conversation with you, I'd like to have the opportunity to start and open a relationship. And I've never had anybody say no. You know, astoundingly, that, you know, again, and relationships will vary. I mean, there's some that you go, they are merely an acquaintance that you would go, if I saw them again, I may not recognize them, or vice versa, you know, that I might have to reintroduce myself, you know, if I see them in another setting somewhere again. But to now they're lifelong family, or they're part of, you know, a future, or that I see being very much connected to. So it's just got to, somebody has to be brave, bold, I don't know the words that people want to use in those spaces for themselves. Say hello.
Have real meaningful relationships. Yeah.
Intentionality.
Thank you. Any thoughts on that, Erica? Or back to the other question?
No, I absolutely agree. It's about starting a conversation and seeing everybody as just as someone else that you want to get to know. And getting to know someone does involve finding out things about who they see themselves as. And so it doesn't have to be that I'm going to go and talk to Faye because she's Indigenous. It's, I'm going to go and talk to Faye because I want to get to know Faye, or Anna, actually you, because we only met a little while ago. but I want to have a conversation because I want to get to know you. I want to understand what makes you tick. I want to understand what's important to you. I want to ask questions, and I'm happy to answer your questions, because only through talking to each other do we find our points of commonality, do we find our points of disagreement if we have any. But you know, relationships are such an enriching part of our lives, and good relationships really depend on getting to know each other better. Now, we can't ever stand in anyone else's shoes. I wouldn't, you know, I can't be you, but if I have the conversation with you, then I might be able to find ways of, I don't know, being someone that can do something good for you. If we don't talk to each other, we just don't know enough about each other to look after each other, whatever that might look like, to meet other people's needs, to, you know, I don't even know what, you know, how I would console you if you were struggling.
So
I would have to ask. And so for me, it's just actually about finding out about somebody else and understanding the parts of them that are important to them. So yeah, I think that's part of it. But if we go back to what I was going to say, you were talking about your students who wanted to be activists. Look, that came out of the literature as well, is that there's a role for in education of healthcare professional education. And obviously we're talking about pharmacy education specifically, but it's not restricted to that, that you can't just leave it at personal transformation. You actually need to have an environment where the rhetoric matches the reality. So there needs to be an understanding that personal transformation is kind of reflected in the way things are taught, what is taught, how they're taught, how they are, just how it all hangs together. And in particular, it's not just about the individual academics teaching it, it's about the whole environment within the institution. It's about not subtly undermining the messages that you want to get across by the institution not rewarding them. And you know, it's actually a whole environmental change that underpins making forward steps in this. And a really critical part of that is to understand that individuals and institutions have a responsibility as being advocates and agents of change, because it's the whole health system really that needs to be, like we all need to be singing from the same song sheet, or whatever the relevant metaphor is for different cultures. And if one part of the system isn't doing that, then the whole system isn't going to work. So it starts with personal transformation, but it doesn't end there. It ends with the people who have I guess had that light bulb moment, sharing it and positively seeking to change things around them where they can.
yeah, I love that. I think there's two little things as we've been talking that I've been thinking. The first one is, my husband asks, can you go and pay the petrol without having a big conversation with the attendant? Like, do you think you could just go in, pay the money and leave again? And I say, no, I can't, because I need to know how they are. I haven't spoken to them all week, and we're friends now. So I've made it part of my practice, not just in health practice, to start to ask people how they are, and then to stop and actually ask, pause and listen. So if someone says, you know, I'm having a custard day today, I'm not go, well, that's lovely, goodbye. Or if they said they've had a good day, how often we go, oh, that's good, carry on. So I just wanted to reflect on that quickly too. We've got lots to talk about, and I know we've got only a little bit more time left. But the next thing was, recently my youngest was in hospital, had surgery, and we were in ICU. It turned pear-shaped, and we came home on the Sunday night, and I sat on the bed and I cried, and my husband said, why are you crying? Everything's okay, he's better now, we're all right. And I said, well, we were in hospital this week, Hannah. I saw 5 of my students that I'd taught. Now they're all doctors and they're all practicing today in really great roles. Not one of them asked me anything about ethnicity. Not one of them created whakawhanaungatanga relationships with us. Not one of them did all of the things that I've been teaching for 12 years. Have I failed my people? And I was crying about me. And he looked at me in 2 seconds. He said, this is not about you, Anna. The institution they work for has not shifted yet. What do you expect them to do? And then I kind of had to get over myself in 2 seconds and move on. So I love that you're talking, Erica, not just about the individual responsibility, but the institutional responsibility to this massive change that we desire to see in our lifetimes. Because it's not a tick box. It's not a one size fits all. But clearly a lot of parts of a puzzle that will make a difference to be able to create the change that we're longing for. And because we only have about 15 minutes left and we all talk too much, is there anything more quickly, Faye and Erica, that you want to touch on before we go to some of the questions perhaps from our audience?
I'd just like to also put into the conversation, though, that we need to look for people who do have different views to our own. If we don't willingly embrace relationships with people of different opinions and different or who've had different experiences, then we don't have richness in understanding what they each bring. And I reflect on when great lifelong friend who is polar opposite to me, and when people find out we're friends, and I would call her a sister, our sisters, they go, oh my God, you're so different, how do you even get on? And you go, because like all relationships, you have to find a way to accept all of that person and what that means, but you do that in a way that still honors your own self. And I think they're the bits that we are actually saying. Everybody will come with a different experience. They will come with different opinions. You have to be willing to hear them, and you have to be prepared at times to consider that I might need to also change, as opposed to seeking everybody else change. And not saying that with regards to the systems needing to change to be more inclusive of Aboriginal and Torres Strait Islander perspectives and Māori perspectives, but we just need to be open to relationships and that they can come in all different spaces.
Absolutely. We have got a question from an attendee. Do we want to go to that question, Erica, or should we?
Yeah, sure, happy.
Cool.
Happy to, yeah.
The question I've got in the box is there research available about non-Western pharmacy or other healthcare outcomes in Australia or New Zealand? And if so, how is it or should it be integrated with pharmacy education and cultural safety? I can clearly talk to what's happening here in Aotearoa, but do either of you want to share first from your own experience?
We'll put out, with regards to other healthcare providers, even within this country, we have some great examples within the community controlled sector that are doing, work across a multitude of areas. As you say, Anna, in Aotearoa, that there is evidence there around non-Western models that have not only been, explored and evaluated and shown as best practice or, evidence and all of those things. We have that here in this country. A lot of other First Nations country that have similar colonisation histories, that there are examples of First Nations-led frameworks and processes that really can be applied to all of our communities that are nuanced, so not just a blanket thing, but that it exists, and we just have to be open to acknowledging that they exist, but also acknowledging that they may exist in other ways that aren't necessarily understood by Western, oral traditions and the acknowledgement of, evidence, as Erica pointed out, as, oldest surviving culture in the world, that a lot of our evidence exists in many ways that hadn't been accepted by Western institutions or organisations as evidence and as knowledge, and we know that they exist.
From my reading of the literature, I think it's fair to say that I was able to identify some great initiatives. The one that's most memorable is actually one from Aotearoa, where I think it was from Otago University's medical program, where well, I wasn't saying that other than because that's where I think it came from, but it was an example of where a medical intern was able to put into effect, is it the whakawhangatanga?
Yeah, whakawhangatanga through the hui process.
Yeah, with in an actual case where they were dealing with a young child who'd had an appendectomy, and the outcome of the process was that because he was familiar with that, and he had sought to do to approach it from the Indigenous, from the Māori perspective, that they were able to avoid any re-hospitalisation as a result. That's the one that most immediately springs to mind. But there are other examples in the literature review, which there's one in psychology. There's a few, and I guess I'd encourage you to read the literature review, really to get more of a flavour for the things that have been done. One of the approaches I think that's that is promising is the notion of a cultural interface, and that is to say, different cultures have complementary things to offer, and it's not a case of one is better than the other. But let's look at ways of using all the knowledges and approaches to get the best possible outcome. So yeah. There are certainly examples in the literature. Just finally to say, it's hard to find them because that's not normally what's in the research literature. And one of the things that came out of the literature review as well was that we have a particular Western way of doing research, which is not necessarily the same way that Indigenous peoples would approach research. And so, we're kind of not stuck in that particular approach, but it does mean that the literature is perhaps less fulsome than it could otherwise be.
I appreciate that. I think that's a really good point to make. I've been teaching Hawara Māori and developed Hawara Māori curriculum for both the medical school and pharmacy school at the University of Otago. One of the key areas that people say, we should be teaching traditional healing processes or how to make rongoa, the Māori traditional remedies. And I've said, actually, we don't need to. There are plenty of Māori that make these beautiful remedies, and we don't base them on in the same way you might in the Western world. We need to think about them as being treasures, taonga, and appreciate that they don't need to be commercialised either. So with a lot of the teaching that I do, it's to really unpack that it's not a one size fits all. And there's so much to learning about rongoa in New Zealand. And it's not just about the remedy or the balm. It's about the mirimiri that goes with the massage that goes with it. It's also about the spiritual side that goes with it. And to be trained in that space and place that my ancestors would be trained as tohunga, that's another whole degree. That's not a pharmacy degree. So you don't need to learn that necessarily as part of your training as pharmacists, but you need to be aware of it. And so recently I asked my students to create posters to raise awareness with pharmacists about how big rongoa is, and that it isn't just this thing that we perceive it to be. And that was a real challenge for many of my students. So I think there's so much that is being done and can still be done to raise awareness around non-Western pharmacy. But I've also got another question here. Shall we move on? I hope that answers that. How do you maintain your amazing resilience in this non-Indigenous space, supporting students in your own well-being? We're all trying so hard to succeed in a space that feels every day to be geared against us. And I really love this question. Faye mentioned something at the start of our talk today about statistics. And at the start of this year, I had a lecture that was really geared at looking at Hawara Māori statistics. At the same time, 5 people had died in my community in 4 weeks. That's 5 people in my whānau that I have connection to. Now, when I was talking numbers on the screen, I was thinking about all these lovely people that I loved. A child at 4 years old, a friend who'd just done my plumbing the week before, random deaths that shouldn't have occurred at the ages that they did. And so clearly there are moments in my sessions where I'm talking to statistics that I'm actually talking about my loved ones, and sometimes I actually need my loved ones to come in and be part of my sessions. I find often bringing my whānau into workshops with me is a real strength and empowers me to look at why I do the mahi I do, because it reminds me that if I can continue to work in the space and help others have aha moments, it will affect change for my children and my children's children. So that gives me a bit of hope, but it doesn't change the reality of the world that I live in. And I think sometimes that reality painted clearly, rather than just ho-hum, here's some stats, really does help other people to understand that we've got to make a difference sooner rather than later. Any other thoughts from my friends?
Can I go on record just to thank, all of the other First Nations people that are working in this space, as professionals, as educators, as facilitators. As pointed out, it's not often an easy space to be in, and we feel these things rather than just statistically. And it is, I talk about the head acquired, the brain acquired head injury that comes from being in this space of constantly having to say the same thing about not being the same, about, looking for different ways of working with people, that, it does. But then I look at my children and I look at my family and I look at and realize that, the work has to be done. And sometimes we'll ask for moments of, can others carry me through? But often, it is just the moment. But I also want to acknowledge every non-Indigenous person that is working in this space in a way that is honouring and acknowledging the work of Indigenous academics and educators, and not just saying I'm an ally, but actually saying I'm an accomplice. So for every time I'm given the privilege of being able to speak to something, and I have a colleague that I know has more information, more lived experience, more knowledge, that I will pass that to. And it's getting better. Not always right, but it is getting better. And so thank you to whomever asked that question, because it is often complex, and we do come to these events with a smile and wanting to embrace people, but you do have moments, as Anna says, where you can often get reminded, are we making a difference? And the answer is yes. It's just the magnitude and the scale of the difference that we want to see and what we are seeing don't always marry up.
It doesn't happen quick enough. I like everything done yesterday. Gosh, if only we could have a magic wand. I don't see any more questions by the attendees. If you do have anything urgently that you want to drop in there and we could respond later, I'd love to now just leave it up to my colleagues to share something, a highlight or a low light from the conversation we've had today. And then I'm going to close in karakia before we finish. Does that sound okay? If anyone else wants to drop something in the chat as a highlight or a low light from the kōrero, we'd appreciate that too.
Sorry, Anna, just seeing that there is somebody here who has had their hand up. That,
I can't.
Lynn, are you able to take yourself off mute and join our conversation?
Oh, you're great.
Oh, thank you, Faye. And it was a mistake. I was going to the Q&A and ran past the raise my hand, but seeing I've done that, I would just really like to say what a wonderful, warm conversation. And I so admire the Pharmacy Council. I'm from the Occupational Therapy Council, and we're, I'd say, a little bit behind in our journey, so I've really learned a lot, and it's been wonderful to hear you sharing your experiences. So thank you very much from a very interprofessional perspective. Thanks.
Kia ora. Deborah, did you have something too to share, to ask?
I was just going to thank you very much. It's been very interesting, and that is the highlight for me, is that we can share this together. Such different experiences, and yet so some the same, but just expressed differently. And language, I've just been so. It's been a highlight to hear you all speaking, and Anna, your the way you speak is so beautiful, and again, it's also how we say the words that has been a highlight today. And Faye and Erica, always your work is outstanding. Thank you.
Kia ora. Anyone else that wants to share something in the chat, feel free, but lovely. I'd just love to quickly give you some space to close. Erica, you first, and then Faye, if that's okay, please.
Sure. Look, Anna, Faye, and the whole group. For me, it is about talking to each other and listening to each other, and listening more than we speak, and asking the questions. Ask how that, like the nurse did. What can I do for you? To look at all of us as individuals, and to ask that question. And it doesn't matter if you're Indigenous or non-Indigenous, actually. Just ask the question, because everybody will have their own space. Everybody will have their own needs and their own way of sharing that. But ask, listen, and in my case, this is a tough one. Don't pontificate too much.
Kia ora, Erica. What a pleasure to have you in this conversation today. A huge mahi to you. Thank you very much. And Faye?
Just want to say mandangu, thank you for the opportunity again, for the leadership being shown by APC, that we do all have a responsibility in this space to create the changes we want to see. And I thank the APC team, the board, for acknowledging that the hot potato that they've received as a gift can sustain and nourish those, but we do need to do the work. And I acknowledge the all of the work that, and the people that are showing willingness to do the hard work that this is going to be. And that, yes, there are opportunities that we will be able to share as part of multidisciplinary learnings, that we can all say, we all have a responsibility, each and every one of us, to do better.
Kia ora. Thank you, Faye. I actually didn't meet these two wonderful people until last week. It's the first time we met was last week. You wouldn't know it. Hey, we've already created relationships on screen. And one day I'll get to travel the ocean back to meet with you. Thank you for your time. Thank you for sharing today. A huge appreciation to the two of you, and to those that made this day possible, and those beautiful people behind the scenes that even put this amazing picture behind us today, and sorting the technical side of things for us too. You all know who you are. A huge mihi to everyone. Can I please conclude now with a karakia? And this is a karakia that we say quite commonly in our country. Many people have sort of argued, that was brought with the missionaries, and should we still be saying it today? And others say, well, it's our anthem, and we all join in together. So if you know kia tau and you want to join in with me, feel free. If you don't, because you have different values, that's okay too. But just to acknowledge that we often open and close to keep things safe. And I really feel today's conversation on safety has been very safe. So again, ngā mihi ki a koutou, inoi tātou. Kia tātou katoa, te ata whai o tātou ariki a ihu karaiti, me te aroha o te atua, me te whiwhi nā tahitanga ki te wairua tapu, ake, amene. Go well, everybody. Have an awesome day. Ka kite.
Thank you.
Thank you.